Welcome back to Student Nurses Station. I'm Nurse Dawn.
And I'm Nurse Jill, and we're both coming to you from the University of California College of Nursing.
Don't forget to like and share and subscribe, and let us know what you want us to cover next down in the comments.
Right, and for all of you listeners out there, don't forget about those free downloadable nursing books linked in the description. They can really help you study.
Yeah, they can help you ace your next exam.
Absolutely. You can even listen to us while you're commuting or at the gym or folding laundry. Every little bit helps.
All right, so this week we're going on a deep dive into a nursing care plan for a patient with pneumonia. And to make it really come to life, we're going to use a real case study.
That's right. We'll be focusing on Mr. John Smith, a 58-year-old who came to the hospital thinking he just had a simple cold.
Yeah, that's how it often starts, right? What makes this case so interesting?
Well, his case really highlights how quickly pneumonia can escalate. Mr. Smith initially experienced fatigue, a dry cough, and congestion. But his symptoms took a dramatic turn within just a few days.
Oh, wow. What kind of changes are we talking about here?
His cough became productive, bringing up thick, yellowish-green mucus. He began experiencing chills, body aches, and his breathing became labored. He even had sharp chest pains with each deep breath.
So that's when his family decided to bring him to the ER.
Exactly. By that morning, he was struggling to breathe, and his at-home oxygen saturation reading was only 92%. He needed immediate medical attention.
Wow. It's a good reminder that what seems like a minor ailment can quickly become serious, especially with respiratory conditions.
Absolutely. So let's use Mr. Smith's case as a framework for walking through the nursing process, starting with assessment.
Okay, so what did the nurses learn during Mr. Smith's initial assessment?
He reported feeling incredibly weak and tired for several days. He was struggling to catch his breath and experiencing chest pain, particularly when breathing deeply.
Those are some pretty significant subjective findings.
Yeah.
What about the objective data? What did the nurses observe?
His vital signs were concerning. His temperature was elevated at 100.3 degrees FSS. His pulse was racing at 110 beats per minute. And his respiratory rate was elevated at 28 breaths per minute.
And we already know his oxygen saturation was low at 92%. Anything else stand out from the physical exam?
When they listened to his lungs, they heard crackling sounds, a classic sign of fluid buildup. Additionally, he was visibly ill and lethargic, and he had a productive cough with thick yellowish-green sputum, suggesting an infection.
So based on all of this information, how did the nurses arrive at a nursing diagnosis?
Putting all the pieces together, the most appropriate nursing diagnosis for Mr. Smith was ineffective gas exchange.
Could you elaborate on what that means for our listeners who might not be familiar with this diagnosis?
Sure. Essentially, it means that his body was having trouble with the crucial process of getting oxygen in and carbon dioxide out. This was evident in his rapid breathing, low oxygen saturation, and the abnormal sounds in his lungs.
It makes sense considering all the evidence we've discussed.
Exactly. Now, once you have a clear nursing diagnosis, the next stage in the nursing process is planning.
So what goals did the nursing team set for Mr. Smith's care?
They set both short-term and long-term goals. The short-term goal was to reduce his difficulty breathing, also known as dyspnea, within 8 hours of starting specific interventions like positioning and cough techniques.
And for the long term?
The long-term goal was to get his breathing rate back to a normal range of 12-20 breaths per minute within 24 hours of dedicated nursing care.
Okay, so they had a roadmap to guide their actions. What specific nursing interventions were implemented to achieve these goals?
They utilized a range of interventions that fall into 3 categories: independent, dependent, and collaborative.
Can you break down those categories for our listeners and give some examples from Mr. Smith's case?
Of course. Independent interventions are actions that nurses can initiate on their own without a doctor's order. For Mr. Smith, this included closely monitoring his vital signs, elevating the head of his bed to ease his breathing, and teaching him deep breathing exercises to improve ventilation and clear secretions.
It's impressive how much nurses can do independently to impact a patient's well-being.
It really is. But sometimes we need to collaborate with other members of the healthcare team or rely on a physician's order for certain actions. That's where dependent and collaborative interventions come in.
Let's talk about dependent interventions next. What did those look like in Mr. Smith's case?
These are actions that require a doctor's order. For example, in Mr. Smith's case, this included administering supplemental oxygen to boost his oxygen levels.
Right, that's not something a nurse can do independently.
Exactly. And they also administered medications prescribed by the doctors, such as bronchodilators, to open up his airways, antibiotics to combat the infection, and medications to manage his fever and pain.
And lastly, what about those collaborative interventions?
Collaborative interventions involve working with other healthcare professionals. For Mr. Smith, this included things like monitoring his progress with chest x-rays in consultation with the physician.
So it's all about leveraging the expertise of the entire healthcare team.
Precisely. They also consulted with a physical therapist who provided additional breathing exercises and postural drainage techniques to help clear those secretions.
That sounds like a truly comprehensive approach to care.
It was. And of course, they didn't stop there. They also carefully planned for a smooth transition back home, ensuring he understood his medication regimen and had follow-up appointments scheduled.
That's a critical part of the process, ensuring continuity of care even after the patient leaves the hospital.
Absolutely. Now, before we move on, I'm curious, what are your initial thoughts on these interventions, Don? Anything that particularly stands out to you?
I think it's fantastic that the nursing team focused on empowering Mr. Smith by teaching him deep breathing exercises and effective coughing techniques. These are skills he can continue to use at home even after he recovers to manage his respiratory health and potentially prevent future issues.
I completely agree. That focus on patient education is a cornerstone of effective nursing care.
So we've laid the groundwork, discussed the assessment, the nursing diagnosis, and the planned interventions. Now I'm eager to hear about the evaluation phase. Did these interventions actually work? Did Mr. Smith achieve the goals set for his care?
That's a great question, and we'll dive into the evaluation and outcomes in part 2 of this deep dive. Stay tuned. Welcome back to Student Nurses Station, everyone.
We're picking up our deep dive into pneumonia nursing care with Mr. Smith's case.
Yeah, before we jump back into his story, I think it would be helpful to take a step back and talk about pneumonia in general. You know, for those who are like, okay, I get the nursing process, but what exactly is pneumonia? What makes it so serious?
That's a great idea. I'm sure many of our listeners are thinking the same thing.
So to put it simply, pneumonia is an infection that inflames the air sacs in one or both lungs. These air sacs, called alveoli, are where oxygen and carbon dioxide are exchanged. Think of them like tiny balloons responsible for bringing oxygen into your bloodstream.
And when those balloons get inflamed and filled with fluid or pus, it makes it much harder to breathe right.
Exactly. That's why shortness of breath is a hallmark symptom of pneumonia. And remember those crackling sounds the nurses heard when they listened to Mr. Smith's lungs?
Right.
That's the sound of those alveoli struggling to function properly.
So it's more than just a bad cough. It's a serious disruption of the respiratory system.
Absolutely. Now here's where it gets really interesting. Pneumonia isn't caused by just one single germ. It can be triggered by various bacteria, viruses, and even fungi.
So it's not as simple as saying, oh, you have a cold, take this antibiotic and you'll be fine.
Nope, not at all. While bacterial pneumonia is the most common type, we also see viral pneumonia, particularly as a complication of illnesses like the flu. You might even be surprised to learn that even fungi can cause pneumonia.
Whoa, a fungal infection in the lungs. That sounds pretty intense.
It can be, but fungal pneumonia is less common and typically affects people with weakened immune systems like those undergoing chemotherapy or living with HIV.
So different causes, different levels of severity, but all impacting the lungs in a similar way. What should nursing students keep in mind when it comes to how pneumonia spreads?
Well, the first thing to remember is that both bacterial and viral pneumonia are contagious, and they spread through droplets released when an infected person coughs or sneezes.
So those basic hygiene practices we've been taught since kindergarten are really important. Cover your mouth when you cough, wash your hands frequently.
Exactly. Simple but effective in preventing the spread of those tiny infectious droplets.
Okay, so we know how it spreads, we know the different types, but who is most vulnerable to developing pneumonia?
Age is a big factor. Infants and young children haven't fully developed their immune system, so they're more susceptible. And on the other end of the spectrum, older adults often have weakened immune systems as well.
So age plays a role at both ends of the lifespan. What about other risk factors?
Smoking is a major one. You know how smoking damages the lungs? Well, that damage makes them much more vulnerable to infection.
That's not surprising. Are there any pre-existing medical conditions that increase the risk?
Absolutely. Things like asthma, COPD, heart disease, and diabetes can all increase the risk of developing pneumonia. And as we mentioned earlier, people with weakened immune systems due to conditions like HIV or cancer are also more vulnerable.
So it's not just about age, but also about the overall health and strength of the immune system.
You got it. And even lifestyle factors come into play. Excessive alcohol consumption, for example, can weaken the immune system.
Like with most things in life, moderation is key.
Exactly. Now, with all this in mind, let's talk about recognizing the signs and symptoms of pneumonia so nurses can be prepared to act quickly.
I think it's important to emphasize that we're not encouraging self-diagnosis here. If anyone suspects they might have pneumonia, They should seek medical attention immediately.
Absolutely. Couldn't agree more. It's always best to err on the side of caution when it comes to respiratory issues.
So, what should people be on the lookout for?
While symptoms can vary, the classic signs include cough, fever, chills, shortness of breath. You might also see chest pain, fatigue, rapid breathing, sweating, and even confusion, particularly in older adults.
Confusion. That's interesting. Why would confusion be a symptom of pneumonia?
It's all about oxygen. When the lungs aren't functioning properly, the brain may not get enough oxygen, leading to confusion and other cognitive changes.
Makes sense. It highlights how pneumonia can affect the entire body, not just the respiratory system.
Exactly. So if someone is exhibiting these symptoms, what's the next step?
Well, as we emphasized, they should seek medical attention immediately. What can a healthcare provider do to diagnose and treat pneumonia?
A healthcare provider will perform a physical exam, listen to the lungs, and likely order some tests, such as a chest x-ray or blood tests to confirm the diagnosis.
And once pneumonia is confirmed, what's the typical course of treatment?
The treatment plan depends on the type of pneumonia and how severe it is. Bacterial pneumonia is usually treated with antibiotics, but it's important to remember that antibiotics don't work against viruses.
So if it's viral pneumonia, antibiotics won't help.
Exactly. Viral pneumonia often resolves on its own with rest fluids and over-the-counter medications to relieve symptoms. Of course, in some cases, hospitalization might be necessary, especially for those with severe pneumonia or underlying health conditions.
This brings us to an important point: preventing pneumonia in the first place. Are there any steps we can take to lower our risk?
Absolutely. Vaccination plays a key role. There's a vaccine for pneumococcal pneumonia, one of the most common types.
Is that vaccine recommended for everyone?
It's usually recommended for infants, young children, older adults, and people with certain health conditions. Your doctor can advise you on whether it's appropriate based on your individual risk factors.
Besides vaccination, what other preventive measures can people take?
Those basic hygiene practices we discussed earlier are crucial. Frequent hand washing and covering coughs and sneezes, avoiding smoking and secondhand smoke is also essential, as is maintaining a healthy lifestyle with a balanced diet and regular exercise.
Those are all great tips. It sounds like a lot of the same advice we hear for staying healthy in general applies to preventing pneumonia as well.
You're absolutely right. It's all about taking care of our bodies and supporting our immune systems. And for those with underlying health conditions, managing those conditions effectively is key to reducing the risk of complications like pneumonia.
Now that we've covered the basics of pneumonia, I'm even more eager to hear how Mr. Smith's story unfolds. Let's shift back to his case study and see what happened after those initial interventions were put in place.
I'm ready when you are.
All right, so we're back with Mr. Smith, and we want to find out, did those interventions actually work?
Right. The suspense is killing me too. Let's see how those interventions played out.
Yeah, so to recap, where did we leave off with Mr. Smith? What was going on?
So we had just talked about all those interventions the nurses were doing, like positioning and deep breathing exercises and the oxygen and medications from the doctor and working with the respiratory therapist.
That whole team approach.
Exactly.
So with all that going on, how did Mr. Smith do? How did his condition change?
Well, the good news is that Mr. Smith was a really good patient. He was very cooperative. He actively participated in the breathing exercises. He was using the incentive spirometer and really seemed to take ownership of his recovery.
That's great to hear.
Yeah.
It's fantastic. We always say patient participation is half the battle.
It really is. It's so much easier to help someone who wants to be helped.
So with all these interventions in place, how did he actually progress?
Well, he actually started showing improvement pretty quickly. The nurses kept a close eye on his vital signs, and they were happy to see his breathing rate and oxygen saturation getting better.
That's encouraging.
Yeah.
What about the oxygen and the medications? Did those help too?
Oh, yeah, absolutely. The supplemental oxygen helped to get more oxygen into his blood, and the medications were working to fight off that infection, open up his airways, and manage his symptoms like the fever and pain.
It just shows how the medications and supportive care can work together to help the body heal.
Couldn't have said it better myself.
Yeah.
And of course, we can't forget about the respiratory therapist who gave him additional breathing treatments and helped clear out all that mucus.
It's really a team effort, everybody working together.
Exactly. And what's interesting is throughout this whole process, the nurses didn't just focus on, the physical stuff. They also made sure to explain everything to Mr. Smith, answered his questions and made him feel like he was part of the process.
I think that's so important. When patients understand what's happening, they're more likely to follow the plan and have a better experience.
Absolutely. Now, I know you're dying to know, did all this hard work pay off? Did he meet those goals we talked about?
I'm dying to know. Tell me, did Mr. Smith recover?
I'm so happy to say he did. After a few days of all this amazing care and teamwork, Mr. Smith got much, much better.
That's great. So his breathing went back to normal and his oxygen levels stabilized?
They did. His breathing rate went back to normal, his oxygen saturation was good, and even his chest pain went away.
Wow. So he was able to go home?
He was. He was discharged with all the info he needed for his medications and follow-up appointments and instructions to keep doing those breathing exercises.
That's really important. It's not just about getting them out of the hospital. It's making sure they can keep getting better at home.
Exactly. I think Mr. Smith's case is a really great example of how much of a difference nursing care can make.
It really is. So as we wrap up this deep dive, what are some key takeaways you hope our listeners will remember from Mr. Smith's journey?
I think the main thing is that nursing is about so much more than just following orders and giving meds. It's about looking at the whole person, their physical needs, their emotional needs, and making sure they understand what's going on.
It's about being there for them every step of the way.
Yeah. And Mr. Smith's story shows us that even with a serious illness like pneumonia, with the right care and teamwork, positive outcomes are possible.
I think this has been a really insightful deep dive, and I hope our listeners feel like they can take what they learned and use it in their own practice.
I agree. It's all about taking those nursing basics and using them for each individual patient.
And don't forget, everyone, this is just one example of a nursing care plan for pneumonia. Every patient is different, and the plan will be tailored to their specific needs.
And before we go, Don, any last words for our listeners?
Yeah, just a reminder to check out those free nursing books in the description. They're a great resource.
And be sure to like and subscribe to Student Nurses Station for more deep dives into nursing.
Thanks for joining us, everybody. And until next time, keep learning and keep caring.